So, let me ask you something. When was the last time you actually looked at your blood work? Not just hand the paper back to your doctor and hear, everything looks fine. I mean, really looked. Understood what those numbers meant for your future, your mobility, your memory, your heart. Because here's the truth that frustrates me. Millions of adults over 60 are walking around right now with dangerous levels hiding in their bloodstream. Levels that a $15 lab test could catch. Levels their doctors sometimes gloss over because they're borderline or not quite concerning yet. But borderline at 63 becomes a hospital bed at 68. That's not fear-mongering, that's math. Today, we're covering the 5 blood tests I believe every single person, especially those of you over 60, should insist on getting at least once a year. Some of these your doctor orders routinely, others you may need to specifically request. I'll tell you which is which. Is whether you're managing a chronic condition, feeling perfectly healthy, or caring for a parent or spouse, stick with me. This information is practical, it's straightforward, and it could change the entire trajectory of your health. Let's get into it. Number 1. The Complete Metabolic Panel, sometimes called a CMP. Think of this as your body's dashboard. 14 different measurements from a single tube of blood, and together they tell you how your kidneys are filtering, how your liver is processing, whether your blood sugar is creeping into dangerous territory, and whether your electrolytes, sodium, potassium, calcium, are balanced. Now, why does this matter so much after 60? Your kidneys lose roughly 10% of their filtering capacity every decade past 40. That's just natural aging. But if you add high blood pressure on top of that, or diabetes, or even years of taking over-the-counter pain relievers like ibuprofen, your kidneys might be declining faster than expected. And you won't feel it. Kidney disease is famously silent until it reaches advanced stages. The CMP catches this early through 2 numbers, your creatinine level and something called GFR, glomerular filtration rate. Don't worry about the fancy name. Just know this, if your GFR drops below 60, that's stage 3 kidney disease, and millions of seniors are walking around in stage 3 without knowing it. Then there's your fasting glucose. This single number tells you whether your blood sugar management is healthy, pre-diabetic, or diabetic. A fasting glucose between 100 and 125 means prediabetes, and at that stage, lifestyle changes can genuinely reverse the trend. Above 126 on 2 separate tests, and you're looking at a diabetes diagnosis. Here's what I want you to remember. Many seniors hear, your sugar is a little high, and think that's normal aging. It's common aging, but common doesn't mean harmless. Uncontrolled blood sugar damages blood vessels, nerves, kidneys, and eyes. Slowly, quietly, over years. Your liver enzymes, ALT and AST, are also tucked into this panel. These catch fatty liver disease, medication-related liver stress, and other issues that rarely produce symptoms until significant damage has occurred. Practical advice: ask your doctor for a CMP at every annual physical. It's almost always covered by Medicare. If your numbers are borderline in any category, don't accept, we'll watch it. Ask what specific lifestyle changes, diet, hydration, medication adjustments could pull those numbers back into a safe range now. Number 2, the lipid panel. You probably know this one as your cholesterol test. But there's more nuance here than most people realize, and after 60, that nuance becomes critically important. A standard lipid panel measures 4 things: total cholesterol, LDL cholesterol, that's the kind that clogs arteries, HDL cholesterol, which actually protects your arteries, and triglycerides, which are fats floating in your blood, usually tied to diet and metabolic health. Now here's where it gets interesting for seniors specifically. For decades, doctors focused almost entirely on LDL. Get that LDL below 100, and you're golden. That was the message. But recent research shows that for people over 60, the ratio between your triglycerides and your HDL may actually be a stronger predictor of heart attack and stroke risk than LDL alone. Here's a simple way to check. Take your triglyceride number and divide it by your HDL number. If the result is below 2, you're in excellent shape. Between 2 and 4, there's room for improvement. Above 4, That's a red flag worth a serious conversation with your doctor. Why does this matter? Because I've seen people with normal total cholesterol who still have dangerous cardiovascular risk hiding in their ratios. And I've seen people with slightly elevated total cholesterol whose ratios are beautiful, meaning their actual risk is low. Let me give you a relatable example. Say you're a 67-year-old woman. Your total cholesterol comes back at 220, and your doctor says it's a bit high. You worry, but then you look deeper. Your HDL is 72, which is excellent. Your triglycerides are 95, and your LDL is 118. That ratio of triglycerides to HDL is 1.3. Honestly, that's a fantastic cardiovascular profile despite the high total number. Context matters. Don't let a single number scare you without understanding the full picture. One more thing about lipid panels after 60. If you've never had a test called LPA, lipoprotein a, consider asking for it. It's a genetic marker for cardiovascular risk that doesn't change with diet or exercise. You only need it tested once in your lifetime because it's determined by your DNA. But knowing your LPA level helps your doctor understand whether you need more aggressive prevention strategies, regardless of your other numbers. Practical tip: get your lipid panel fasting. Nothing but water for 9 to 12 hours before the draw. This gives you the most accurate triglyceride reading, and if you're on a statin medication, this test helps your doctor confirm whether your current dose is actually doing its job. Number 3, and this one is absolutely essential if you're over 60. Hemoglobin A1C. Think of it this way. Your fasting glucose, which we talked about in the metabolic panel, gives you a snapshot, one moment in time, what your blood sugar was doing that particular morning after you fasted all night. But A1C gives you a 3-month average. It tells you how your blood sugar has behaved day and night, after meals and between meals, for roughly 90 days. That's an enormous difference. Someone can have a perfectly normal fasting glucose and still have a dangerously elevated A1C because their blood sugar spikes wildly after every meal and then comes back down by morning. Their fasting number looks fine, but their blood vessels are being battered all day long by those spikes. Here's the scale. Below 5.7%, normal. Between 5.7 and 6.4%, prediabetes. At or above 6.5%, diabetes. And here's what concerns me about the senior population specifically. After age 60, insulin resistance tends to increase naturally. Your cells become less responsive to insulin, which means sugar lingers in your bloodstream longer after eating. Combine that with reduced physical activity, medications that affect blood sugar, like certain blood pressure pills or steroids, and you've got a recipe for A1C creeping upward year after year without any dramatic symptoms. Many seniors ignore the subtle signs: feeling more tired after lunch, needing to urinate more frequently at night, wounds healing just a little slower than they used to. These aren't just getting older. These can be early whispers of blood sugar problems that an A1C test would catch immediately. If you're over 60 and caring for an elderly loved one, this information could be life-saving. A parent who seems increasingly fatigued, confused in the afternoons, or whose vision has subtly changed, an A1C test might reveal exactly what's driving those symptoms. Practical guidance: even if you're not diabetic, request an A1C test annually after 60. If you're prediabetic, that 5.7 to 6.4 range, know that walking 30 minutes daily and reducing refined carbohydrates can drop your A1C by a full point within 3 months. That's the difference between prediabetes and normal. It's achievable. It's not a death sentence, but you have to know your number first. Number 4, your thyroid. Specifically, a TSH test, thyroid stimulating hormone, ideally paired with free T4. I cannot tell you how many seniors I've encountered or heard from who spent years thinking they were just slowing down with age, gaining weight despite eating less, feeling cold when everyone else was comfortable, losing hair, battling constipation, feeling foggy, forgetful, depressed, and then one blood test revealed their thyroid was barely functioning. Hypothyroidism, an underactive thyroid, affects roughly 20% of women over 60 and about 10% of men in that same age group. 20%. That's staggering. And because the symptoms overlap so heavily with what people expect aging to feel like, it goes undiagnosed for years in many cases. Your thyroid gland sits at the base of your throat, small and butterfly-shaped, and it essentially controls your metabolism. Every cell in your body depends on thyroid hormones to function at the right speed. When production drops, everything slows. Digestion, circulation, brain processing, energy production, even your reflexes. TSH is the screening test. When your thyroid is underperforming, your brain releases more TSH to try to stimulate it, like pressing the gas pedal harder because the engine is sputtering. So a high TSH means your thyroid is struggling. Normal TSH ranges from about 0.5 to 4.5, though many endocrinologists argue that anything above 2.5 deserves further investigation, especially if you have symptoms. Free T4 measures the actual thyroid hormone circulating in your blood. If TSH is high and free T4 is low, that's a clear diagnosis. Your thyroid needs support, usually in the form of a daily medication called levothyroxine. It's inexpensive, well-tolerated, and for many people, it feels like someone turned the lights back on after years of dimness. On the opposite end, less common but equally important, hyperthyroidism means your thyroid is overproducing. Symptoms include unexplained weight loss, rapid heartbeat, anxiety, trembling hands, and difficulty sleeping. In seniors, hyperthyroidism can trigger dangerous heart rhythms, so catching it matters enormously. Practical advice: request a thyroid panel annually after 60, especially if you notice fatigue, weight changes, mood shifts, or temperature sensitivity that wasn't there before. If you're already on thyroid medication, ensure your doctor checks levels every 6 months, because dosing needs often change as you age or as other medications are added. Number 5, and this one is a combination that I believe every senior should have checked: vitamin D and vitamin B12. These aren't dramatic tests. They don't sound as urgent as cholesterol or blood sugar, but deficiencies in these two nutrients are shockingly common in older adults, and the consequences are anything but trivial. Let's start with vitamin D. Your skin produces it from sunlight, but after 60, your skin becomes roughly 75% less efficient at this process compared to when you were 20. Add in the fact that many seniors spend more time indoors, wear more clothing for warmth, apply sunscreen diligently, and live in northern latitudes, and you've got a perfect storm for deficiency. Why does it matter? Vitamin D is essential for calcium absorption and bone density. Without adequate levels, your bones thin faster, fracture risk climbs, and osteoporosis accelerates. But beyond bones, low vitamin D is linked to weakened immunity, increased inflammation, muscle weakness, depression, and even cognitive decline. Studies have connected severe deficiency with higher rates of falls in elderly adults because the muscles simply can't fire properly without adequate D levels. Optimal vitamin D blood levels are generally between 40 and 60 nanograms per milliliter. Many doctors consider anything above 30 acceptable, but researchers increasingly argue that 40 plus offers the most protection for seniors. If you're below 30, supplementation is almost certainly needed, typically 2,000 to 5,000 IU daily, depending on how deficient you are. Now, B12. This vitamin is crucial for nerve function, red blood cell production, and brain health. And here's the problem. As you age, your stomach produces less acid. B12 from food requires stomach acid to be properly absorbed. So even if you eat plenty of meat, eggs, and dairy, the primary food sources, you might not be absorbing enough. B12 deficiency mimics dementia. Let that sink in. Confusion, memory loss, difficulty concentrating, personality changes. Families sometimes assume a parent is developing Alzheimer's when the actual culprit is a vitamin deficiency that's completely reversible with supplementation. Other symptoms include tingling and numbness in hands and feet, which gets blamed on neuropathy or poor circulation, balance problems, fatigue, and a smooth, sore tongue. A blood level below 300 picograms per milliliter warrants attention, and many experts consider levels below 500 suboptimal for neurological protection in seniors. Practical guidance: get both tested annually. Vitamin D supplementation is inexpensive, pennies per day. B12 can be supplemented orally or through periodic injections if absorption is severely impaired. These are simple, correctable deficiencies that dramatically affect quality of life when left unaddressed. So let's bring this together. 5 blood tests. That's all we're talking about. A complete metabolic panel to monitor your kidneys, liver, blood sugar, and electrolytes. A lipid panel to understand your true cardiovascular risk beyond a single cholesterol number. Hemoglobin A1C to reveal how your blood sugar actually behaves over 3 months, not just one morning. A thyroid panel to catch the silent slowdown that mimics aging but is entirely treatable. And vitamin D plus B12 to protect your bones, brain, nerves, and immune system from deficiencies that are absurdly common and absurdly easy to fix. 5 tests, 1 blood draw in most cases, covered by Medicare and most insurance plans. And yet millions of people over 60 haven't had all 5 checked in the past year, or ever. Here's what I want you to take away from today. You don't have to guess about your health. You don't have to accept fatigue as normal. You don't have to wait until something breaks before you investigate. Blood work is your early warning system. It's the smoke detector that goes off while the fire is still small enough to stomp out. Write these 5 tests down. Bring the list to your next appointment. Tell your doctor, I want these checked. You have every right to advocate for yourself, and if your doctor resists, ask why. You deserve to know your numbers, and if you're watching this on behalf of a parent, a spouse, an older friend, share this video with them. Sometimes the most loving thing you can do is hand someone information they didn't know they needed. Take care of yourself, not with worry, with knowledge. Knowledge is the gentlest form of prevention there is. If this was helpful, subscribe to the channel. We put out new senior health content every single week designed to keep you informed, empowered, and ahead of problems before they start. Drop a comment below and tell me, which of these 5 tests surprised you most? Which one are you going to request at your next appointment? I read every comment, and your experiences help other viewers too. Share this with someone you love, because everyone deserves to know their numbers. Take good care. I'll see you in the next one.